I'm Fred Karnas. I'm a senior fellow at the Kresge Foundation, where my role is to work with our American Cities project and also serve as an advisor on housing across our 6 teams that work on a variety of areas, from healthcare and human services to community development. About 6 years ago, we took a dramatic change in our work and have focused on urban issues and vulnerable populations. And we come at that through 6 different teams that work on upstream healthcare issues like housing, building the capacity of nonprofit organizations, and embedding arts and culture in low-income community development. Our corpus is about $3.5 billion, and we give out about $130 million a year. The Social Innovation Fund has given people the resources to begin to be able to sort of think beyond their day-to-day effort, and I think that's a really important first step. And then beyond that, then I really think these sort of new partnerships that are emerging in the communities between the housing world, between managed care organizations, between hospitals, are really the key to sort of recognizing that we can't operate in 2 sort of siloed systems between the housing world and the healthcare world. As the president said early on in his administration, you know, people don't come with a HUD problem or an HHS problem or a VA problem. They come with a set of issues that we need to be able to cross those boundaries with. CSH's brand is strong, and we've worked with CSH over the years. I personally have been on the board of CSH, and we felt that we're partnering with a strong organization, and that's always important to us. Clearly, there are a whole range of other issues. I mean, the innovation involved, the efforts across a broad geography to sort of look what works in different communities. Medicaid's different in every state. Local systems are different, and that's really important. And I think the final thing would be both the other partners, the Corporation for National Service, of course, but also the local partners and the sort of building this network at the local level that's really critical. Having run nonprofits in the past myself, it's hard to sort of get beyond the day-to-day demands of your work to sort of think more at a systems level and think about how you build different partnerships. The hospitals I've talked to, particularly the managed care organizations I've talked to, are really looking at this partnership as a new way of doing business. And you know, they're not all on board yet, and it varies from state to state and community to community. But the ability to sort of meet their bottom line, have better outcomes for their clients, and create a better working system, I think, is really high on the list. The data piece is really important, but the qualitative piece is also important. The stories of the people whose lives you're affecting really, I think, can have an impact, and I think we sort of have lost that a little bit in the recent conversations. The other thing is, I think partnerships need to be sustained, and it needs to be an ongoing effort. You've put together partnerships over the last few years, but you've got to keep going on that front. The partnerships do 2 things at least. One is they bring perhaps more resources to the table, but the more I'm involved in this world, the more I recognize that the more we sit across the table from talking to each other, we begin to understand how each other's world works, and we can build a better system that way.